So this rally is in support of the Healthcare Emergency Guarantee Act. Those are the House numbers of the bill, 6906, 3790. So as I mentioned in the intro, there's so many people now that are uninsured. There were 87 million who were uninsured or underinsured before. People that underinsured means people that still couldn't afford to go to the doctor even though they were insured because they couldn't afford the out-of-pocket costs. So this gives us a really big opportunity to try and think about how we can cost-effectively cover people during a pandemic that have lost insurance, that can't afford to go to the doctor. And Representatives Pramila Jayapal and Senator Bernie Sanders have introduced the Healthcare Emergency Guarantee Act. So this is a bill that was introduced in both the House and the Senate that would rise to meet public health care needs during the pandemic until there is a widely available vaccine by authorizing Medicare to fully cover the cost of all medically necessary health care for all uninsured patients, regardless of diagnosis. So none of this just for COVID-19 stuff, because why is it just that people that have COVID-19 should be able to get health coverage? It should be anyone that needs it should get it. And then the part that I really love is to fully cover out-of-pocket costs for healthcare expenses for all people with insurance, regardless of diagnosis. So it takes away all the cost barriers to care that so many of us face when we go to the doctor, either uninsured or, again, if we're underinsured, have insurance. And I would say that the majority of us, even with employer health care, are underinsured because most of us have really, really high deductibles. And again, it's the crooks in the insurance company, like Dominic said, that just really want to just get as much profit as they can. Just want to say that United Healthcare had $5 billion in profits in the first quarter of 2020. In the middle of a pandemic, they made massive, massive profits. There's something wrong with a system where that happens. So this, we see the Health Care Emergency Guarantee Act, we're really excited about it because we see it as a pathway to what we're really excited about, which is Medicare for all. Dominic?
All right, our goal is to pass the Medicare for All Act, H.R. 1384. It gives health care coverage to all U.S. residents from birth to death and eliminates out-of-pocket costs, no premiums, co-pays, or deductibles. Covers all medically necessary services, including dental, hearing aids, vision, mental health, prescription drugs, long-term care, and home health care. Saves money with the measure like global budgeting and negotiating price for drugs and medical devices. Now, that's something that no other bill or no other proposal brings to the table. The only way to guarantee these things, only way to guarantee a cheaper, better system is to guarantee healthcare to every U.S. citizen and everyone here.
Sorry, my dog is barking, so I apologize for that. I was trying to hit mute, but when you're sharing screen, you cannot do that. So let me reshare the screen. Okay. Okay, so throughout this digital rally, we are going to give you opportunities for action. The thing is, we, as our first speaker is going to talk about, we are really facing a mass misinformation campaign, and the facts are on our side. Improved Medicare for All is not just the morally right choice for our country, it's actually the economically, the financially, the fiscal right choice for our country. It will save us money in the long run, and so we really need your help in getting the word out. So as you saw some of the work that we're doing, one of the actions that you can take is join us in our work to enact Improved Medicare for All by joining one of our working groups. Right now we're doing communications, education outreach, and legislative. And the link on the bottom is to a form on our website where you can actually sign up for any of those working groups. So we're super, super excited about that.